Good morning, students. In this video, you are going to learn about care of child with mental retardation. The objectives are students will be able to define the terminologies related to mental retardation, recognize the etiological factors of mental retardation, classify the types of mental retardation, specify the diagnosis for mental retardation, and describe the nursing management of child with mental retardation. Mental retardation, MR, is a condition of arrested or incomplete development of the mind, which is specially characterized by impairment of skills manifested during the developmental period, which contribute to the overall level of intelligence, that is, cognitive, language, motor, and social abilities. About 3% of world's population is estimated to be mentally retarded. In India, 5 out of 1,000 children are mentally retarded. Common in boys than girls, mortality is high among severe and profound mental retardation due to associated physical diseases. MR is more accurately considered a disability rather than a disease. There has been a transformation in the care of people with MR since the late 1960s. Advances in a number of fields and disciplines including genetics, psychopharmacology, developmental neuropsychiatry, psychology, and education have also shown promises for improving treatment and lives of people with mental retardation. With appropriate support and teaching, most individuals can learn to do many things. There are specific programs that people with developmental disabilities can take part wherein they learn basic life skills. Anything from independence in toothbrushing to independent residence. People with developmental disabilities learn throughout their lives and can obtain many new skills even late in life with the help of their families, caregivers, nursing staff, the clinicians, and the people who coordinate with the efforts of all these people. I want you to learn the different terminologies related to mental retardation. First, what is mental retardation? It is defined as a significantly sub-average general intellectual functioning resulting in or associated with concurrent impairments in adaptive behavior and manifested during the developmental period, according to American Association on Mental Deficiency in 1982. Significant sub-average. It is defined as an intelligence quotient IQ of 70 or below on standardized measures of intelligence. What is adaptive behavior? It is defined as the degrees with which the individual meets the standards of personal independence and social responsibility expected of his age and cultural group. Intelligence quotient IQ. It is the ratio between mental age MA and chronological age CA. Developmental period. It is defined as a period of time between conception and the 18th birthday. Let's discuss the etiology of mental retardation. It is enumerated under genetic factors, prenatal factors, perinatal factors, postnatal factors, and other factors. Now, genetic factors. Genetic factors meaning it is passed down from one's parents. The chromosomal abnormalities such as Down syndrome is a genetic chromosomal 21 disorder, then Fragile X syndrome, Trisomy X syndrome, Turner syndrome, Cat-Cry syndrome. It's chromosomal condition when a piece of chromosome 5 is missing. The child has a high-pitched cry, resembles a cry of a cat. And Prader-Willi syndrome It's a deletion of a part of chromosome 15 passed down by father. Then metabolic disorders such as phenylketonuria is an amino acid phenylalanine it is built up in the body, and Wilson's disease, it is inherited disease, causes too much copper to accumulate in the organs. Galactosemia and cranial malformations such as hydrocephaly and microcephaly, and gross diseases of brain such as tuberous sclerosis. It's a rare disease, causes tumors or growths in brain and other organs. Neurofibromatosis, it's tumors, it's formed in brain, spinal cord and nerves. Epilepsy. And prenatal factors, meaning that occurring before birth, such as infections like rubella, cytomegalovirus, syphilis, toxoplasmosis, herpes simplex. Endocrine disorders such as hypothyroidism, hypoparathyroidism, diabetes mellitus, and physical damage and disorders like injury, hypoxia, radiation, hypertension, anemia, emphysema, intoxication such as lead intoxication, certain other drugs, substance abuse, placental dysfunction, toxemia of pregnancy, placenta previa, cord prolapse, nutritional growth retardation. Perinatal factors. Perinatal period meaning the period of time when the woman becomes pregnant and up to a year after giving birth. And during this period could be oxygen deprivation during delivery and birth asphyxia, prolonged or difficult birth, kernicterus, instrumental delivery resulting in head injury, intraventricular hemorrhage, prematurity and low birth weight. And postnatal factors, the period is immediately after the birth until 6 weeks, extreme deprivation, diseases such as encephalitis, meningitis, measles, septicemia, lead poisoning, other mental disorders, examples autism, ADHD, attention deficit hyperactivity disorder. Other factors include environmental factors and socio-cultural factors. So cultural deprivation could be low socio-economic status, inadequate caretakers, child abuse. Mental retardation is classified under 4 types based on IQ calculation. Mild mental retardation, the IQ falls between 50 to 70. These children have minimum retardation in sensory motor areas. Moderate mental retardation, the IQ falls between 35 to 50. About 10% of mentally retarded come under this group. Severe mental retardation, the IQ falls between 20 to 35. It is often recognized early in life with poor motor development and absent or markedly delayed speech and communication skills. Profound mental retardation, the IQ is less than 20. It accounts for 1 to 2% of all mental retardation. The achievement of developmental milestone is markedly delayed here. They require constant nursing care and supervision. Associated physical disorders are common. Having seen the classification of mental retardation, now I would want you to appreciate the behavioral manifestation of mentally retarded children in the aspect of self-care ability, education level, social skills, and economical situation. How does it vary from mild, moderate, severe, and profound retarded child? So let's go one by one. Self-care ability, as you all know, It's like, your self-feeding, self-dressing, grooming, hygiene, toileting. The child may be able to live somewhat independently with monitoring or assistance, and especially when the child comes across challenges or stressors like personal illness or the death of loved ones, usually parents or siblings, still the child is able to manage as far as the mental retardation is mild. Let's see, the moderate retarded child requires close supervision and must be supervised in performing certain independent activities. Severely retarded child require complete supervision, but may be able to perform simple hygiene skills such as brushing teeth and washing hands. Profoundly retarded child require constant assistance and supervision. Now, the education level. The mildly retarded child can achieve reading skills up to the level of primary school, like usually 8th standard, and master vocational training, which help them to live independently and earn their livelihood, like stitching, candle making, spice packing, book binding, knitting, basket making, carpentry, shoe repairs, handicrafts, even fashion designing, beautician courses, hairstyling, home cleaning, electrical repair, automotive repairs, photography. Moderately retarded child can achieve skills up to second class and may be trained in skills to participate in a workshop setting, mainly concentrating on developing creativity, interpersonal relationship and communication too. And a severely retarded child may learn a few simple skills. Profound retarded child cannot benefit from academic training. So when it comes to social skills, like mainly social skills is your, developing interpersonal relationship, your friendship with others, understanding each other, and keep going with the group you are in, and, the communication. The child with mild retardation can learn and use social skills in structured settings. The settings which the child knows already, may be her home or any other place where the child is living in. The moderately retarded child has certain speech limitations and difficulty following expected social norms, and severely retarded child has limited verbal skills and tends to communicate needs non-verbally or by acting them out. We will see this in, I will explain to you this when we go with nursing management. Profound retardation, the child has little speech development and lacks social skills. And next aspect is economical situation. Mildly retarded child can perform a job under close supervision and manage money with proper guidance. Moderately retarded child may learn to handle a small amount of pocket money as well as how to make change. Severely retarded child may be taught how to use money unsupervised while shopping. Profoundly retarded child must depend on others for money management. How do you diagnose mental retardation? Usually made after a period of suspicion, like, after monitoring the milestones of the child or the behavioral manifestations, made at birth from recognition of specific syndromes such as Down syndrome, and based on standard IQ scores. Now we have come to the important aspect, that is nursing management of child with mental retardation. And more than you as a nurse managing the child, it is a challenge that how you are there to help the parents and the caregivers as how to manage a child with mental retardation. It's discussed under various aspects. The first one, assess all children for signs of developmental delay. So how are you going to do? Behavior of high-risk children, such as children born to elderly primi gravida with birth trauma, etc., to be closely observed. Behaviors such as non-responsiveness to contacts, poor eye contact during feeding, slow feeding, reduced spontaneous activity, decreased alertness to voice or movement, or if the child is irritable. Assess and document daily living skills. Assess the family too. The family's response to the child. If any other family members with impairment present, degree of independence encouraged at home, stability of family as one unit if they are stable. Psychological assessment to be done, mainly related to interpersonal relationship within the family members, and also if there is opportunities for learning new skills, achieving maximum choice about the way of life available or not. Next, administer prescribed medications for associated problems. So there is a possibility the child is given certain medications. So you as a nurse has to administer the medications at the right time and with all the care. Such as anticonvulsants are given for seizure disorders and methylphenidate, that is Ritalin, given for child with ADHD, attention deficit hyperactivity disorder. Support the family at the time of initial diagnosis. This is very, very important. The support, if it is a healthy support, it's so strong. I mean, you have given them so much of support when the child's diagnosis is told to the parents. It is of much help in giving or taking care of the child later on. Parents must be helped to ventilate their feelings, clear their doubts, and accept the child. And you have to have a active listening to their feelings, concerns, and assist their composite strength, the stronger side of their whatever they can be for their child. Then promote optimal development by encouraging self-care goals and emphasize the universal needs of children such as play, social interaction, and parental limit setting. Promote anticipatory guidance and problem solving by encouraging discussions regarding physical maturation and sexual behavior, as these children may form emotional attachment to those of the opposite sex and have normal sexual desire. So as a nurse must maintain a non-threatening approach and give adequate guidance to parents and ensure that the child is under safety and protected well. Assist the family in planning for the child's future needs. For example, finding alternative to home care, especially when the parents are aging. Refer the child to community as agency. Services are provided, usually residential accommodations, productive daycare involvement, supportive services such as respite homes or parent training, and some clinical services like where the use of psychotropic medication is taught. Provide child and family teaching. Identify normal developmental milestones. Help the parents to identify the normal developmental milestones and appropriate stimulating activities, including play and socialization. Discuss with them the need for patience with the child's slow attainment of developmental milestones. Usually they tend to be comparing, they tend to get irritated, things like that. So help them out. Inform parents about stimulation, safety, and motivation. Supply information regarding normal speech development, and especially the how to accentual non-verbal cues. I told you when we were discussing the previous slide that I will be telling you, the child will have some cues, such as facial expression of her or his own, and body language, loudness of tone of voice. This will help. So the parents have to be, help to monitor, to observe their own child. It may differ from child to child. So they would know. So what is her, non-verbal cues that she uses in order to get her needs met. Explain the need for discipline that is simple, consistent, and appropriate to the child. Review an adolescent's need for simple, practical, and sexual information with the parents that include anatomy and physical development and conception. Point out the importance of positive self-esteem built by accomplishing small successes in motivating the child to accomplish other tasks. Parent counseling. Give correct information regarding condition of child with mental retardation. Avoid building false hopes in the parents. Help parents develop right attitude towards the child. Help to prevent overprotection, rejection, handling the child harshly. Create awareness in parents regarding the role in training the child. Take time to teach behavior modifications techniques such as positive reinforcement, shaping, modeling, etc., which can increase adoptive behavior and develop new skills. Encourage the prevention of mental retardation, very important. Explain and bring forth steps to achieve various levels of prevention, primary, secondary, and tertiary. When you think of primary, it's the genetic counseling, immunization of maternal rubella, adequate maternal nutrition, family planning in terms of size, appropriate spacing, age of parents. Then about prenatal care, adequate nutrition, fetal monitoring and protection from disease. Avoidance of teratogenic substances like exposure to radiation and consumption of alcohol and drugs. Analysis of fetus for possible genetic disorders, amniocentesis, fetoscopy, fetal biopsy, ultrasound are available. At delivery, see that the delivery is conducted by expert doctors, monitoring APGAR score, close monitoring of mother and child. And when you think about early detection and prompt treatment of preventable disorders like phenylketonuria, hypothyroidism. So when it comes to rehabilitation in vocational, physical and social areas to reduce disability, providing optimal function of child with mental retardation. So these are the various nursing responsibility, or how do we take care of the patient or the child with mental retardation. The take-home message: mental retardation results from many causes, medical conditions, brain damage, genetic causes, and certain psychiatric conditions. The management of clients with mental retardation is to assess the individual needs and competencies of each person. People with intellectual disabilities can live meaningful, satisfying, and productive lives within their own communities when provided adequate support. Nurses can work tirelessly to improve the lives of these deserving citizens.